Hey, welcome everybody to the seminar, our webinar. Thank you. Thank you for tuning in. This is going to be a webinar on just going over rehabilitation following total hip and total knee replacement surgery. So my name is Robert McCabe. I work at OrthoSC Market Commons location. And for the next half an hour or so, we'll be talking about just a general overview of rehabilitation after total knee and also total hip replacement. There'll be plenty of time to field some questions. So please, throughout the seminar, just ask questions, whether they be issues relating to the surgery. I'll do the best I can to answer that. But more likely due to the rehabilitation and overall just the recovery after knee and hip replacement surgery. So I'm going to pull up, we'll pull up the presentation, and we're going to get started here. Second. Okay. Good. All right. So physical therapy and recovery following total hip and knee replacement. So what we're going to do is talk about, just excuse me for 1 minute. We're going to talk about prevalence of hip and knee arthritis. How common is it? We're going to talk about who develops hip and knee arthritis that may lead to hip and knee replacement. So we'll talk about some risk factors. I'm going to spend a little bit of time talking about prehabilitation, and this is physical therapy prior to the surgery, which is being done more often now as compared to years past. And then we will go in and talk a little bit about rehabilitation, just very general overview, give you a general understanding of the time frame for rehab. And then finally, we'll talk about recovery and return to activity and have some time left over for some questions. Knee and hip arthritis, as you probably are aware, is very common. Just to throw out some statistics here, about 25% of adults have arthritis of some form. And there are approximately 600,000 total knee replacements done every year. It's one of the more common orthopedic surgeries. In fact, it may be the single most common orthopedic surgery. As far as hip replacements, a little less. There's about 450,000 hip replacements done every year. Overall, there is an upward trend of these type of surgeries due to the aging population. And some have even talked about the fitness craze of the 1980s when the fitness boom first started. Well, those individuals are now entering the 7th decade of life, and many of those patients have been highly active for many years. Perhaps that accelerates some of the wear and tear. We see that with the aging athlete who has been running, marathons, for example, over many years and even 30, 40 years. So let's talk about some risk factors. Women are a little bit higher risk than men for having both a hip or a knee replacement, and that's because we're built differently. Men, if you look at a male posture or lower leg from the hip down to the foot, guys or males, we tend to be straight up and down, whereas females have this angulation due to the wider hip. And that puts more stress on the actual knee itself and also the hip. So some of this is related to our alignment, which is also can be a function of our gender, whether you're male or female. There's maybe some there's some evidence about how there may be some relationship to hormonal changes, and that may be a factor as well. Obesity. So if you're overweight, it makes sense that over a long period of time, you would wear out your joint a little bit earlier. And this has been shown to be a strong risk factor for hip and knee arthritis, and also down the road replacement. Prior knee injuries, often you'll have the patient come in, and typically many times they'll have a prior knee injury or a hip injury. For example, if a patient tears the meniscus in their knee, which is the shock absorbing cartilage pad in your knee, then you've lost that shock absorption. So over many years, decades, this can maybe lead to earlier wear and tear. Same thing with back injuries. You know, just think of it as a chain up and down from the back all the way to the foot. Any injury along the way in that chain can put stress on the joint above or below. So we see patients with back problems later develop hip problems and vice versa. With occupations, often you'll have, if you're involved in heavy manual labor, then that's a risk factor. Sports, you know, there's a good side, there's a benefit to sports and exercise, but anything can be overdone. And for example, going back to the marathon runner, I would say that those individuals that are putting on extremely high mileage, and we're talking, you know, for example, patients that run, you know, 50 miles a week or more, those patients, there's evidence to show that they may be at risk for a little bit earlier wear and tear. So the key is to exercise in moderation. I know that sounds like a common sense, but it's actually backed up by some evidence. They recently, I don't know how recently this was done, but they've isolated a gene that is even connected to osteoarthritis in general. So this makes sense that this would have a genetic component as well. And we see that a lot with other injuries, tendon injuries, rotator cuff injuries, and those kind of things. So these days, prehabilitation is physical therapy before the surgery. And this can be very useful. And however, it is not always necessary, but it does improve the rehabilitation process for some patients. And the whole purpose of physical therapy prior to the surgery is to activate these muscles shown on the right. Your thigh muscles, otherwise the quadriceps, are extremely important, particularly following knee replacement surgery. Not as much for hip. For hip replacement surgery, the hip muscles are more important. But, you know, after a knee surgery, what happens is these muscles shut down. They call it muscle inhibition, swelling, pain, whatever, tends to shut the quadricep muscles down. They turn off. You can't tense your thigh that hard, if at all, right after surgery. So by getting rehab right up until the surgery, perhaps a day or two before, we call this muscle memory. And that is, you're going to activate these muscles, get the connection between the muscles and the brain, prime that whole connection process. And then after the surgery, you'll have this memory of how to turn those muscles on quicker. So that's one of the main purpose, at least for pre-operative knee replacement surgery. I would say that it's not as important for hip replacement surgery because those muscles in the hips don't shut down like the knee thigh muscles do for someone going for a knee surgery. So we don't see that as much for the hip. The other thing I want to mention is not always necessary. So if somebody has, you know, like this individual here in the picture, you can tell they have really well developed thigh muscles. Most likely that person's not going to have this shut off after, and they don't need the prehabilitation as much. So after the surgery, you know, there are different phases, and phase one, you often I get a lot of questions from patients that are considering knee replacement surgery. They're coming in for physical therapy. We're treating their arthritis. They haven't made a decision on surgery. They always ask, "Well, how bad is the rehab?" I heard it's really intense, and that is very variable. I will tell you that this week alone, we had a couple, 3 or 4 patients come in with knee replacement surgery. And 2 of those patients told me that they had very little pain after the first 2 days. So that's a little bit on the unusual side. But then we have patients, obviously, that have more pain. And, I have not figured out pain, and there's so much behind pain and pain science that we don't know. People are just wired differently. And some people have more pain than others. But in general, that first phase, the first 14 days are the roughest. This would be where you're going to have this maximum inflammation. The surgery itself is very involved. A lot is done in the surgery. And so there's a lot of trauma to the soft tissue, including the bone, and also the muscle as well. So you tend to have a lot of inflammation after the surgery and quite a bit of swelling, particularly more for knee versus hip surgery. And we're going to talk about how hip surgery is actually a much easier surgery than knee replacement surgery. Hip replacement is easier than knee replacement. But early on during that first week, we're not having patients do a lot of high intensity. Obviously, we're going to basically use a lot of ice, reinforce that at home, elevating the leg, activating those muscles that we talked about before. And then we like to get the knee straight as soon as possible. Compression stockings are worn, which many patients are not a fan of, and understandably, but that's extremely important to minimize the chance of having a blood clot, otherwise called a D.P.T, develop, which is the last thing we want. So compression stockings are worn for a period of time, for a couple of weeks at a minimum, and elevating the leg a lot at home. I'm not going to lie to you, sleeping is a little rough that first week. I've had a couple patients come in again this week alone that said they didn't have much of a problem with that, but I wouldn't say that's the norm. So you tend to lose some sleep during that first week, which can make that also difficult, that particularly during that first week or so. Once you, well, we'll just show, these are some things that we would go over with you to avoid after the surgery. You're going to typically be sleeping with your leg elevated. The bottom picture shows it, where we would have them laying down and reinforcing using pillows underneath the calf and not bent like this as shown above. Also, the surgery itself causes some fatigue. Any type of surgery to the body causes systemic changes in hormone levels, most likely. There's a lot of energy expended, after a surgery during the healing process. Your body, contributes a lot of energy towards healing, and that can kind of make you tired, can fatigue you pretty quickly. And then you add on that top of that, the loss of sleep. So, and then there may be some medication issues that can lead to some constipation, particularly if you're on certain medications, such as, well, I'm not going to get into the specifics, but some medications do cause constipation. And so that can make this a little bit more of a rough phase. Okay, so let me just go over to here. Okay, so we're going to quickly go on and talk about, these are the compression stockings that are typically worn. They they come up to about the mid-thigh, and these need to be worn after the surgery. And these are kind of some of the early exercises. Yes, we get patients on a exercise bike like this within about 10 days, which is surprising to some patients, but this is called a short crank bike. It's not allowing your knee to bend too much. So most patients can get on this in about 10 days after the surgery. Gait training or practicing walking. Typically, we use a walker for the first week or so, a rolling walker. And then the next step after that would be a cane. And we may have a patient on a cane for perhaps a week, maybe a little bit longer. I would say most patients are not using an assistive device after about 2.5 weeks. And, but again, that's variable. Some patients need to stay on it a little bit longer than the others, depending on how fast you get your strength back and, of course, how much pain there is. Manual therapy, where I would say some of the discomfort comes in with physical therapy, is that we want to get your knees straight right away. That's why it's important to start physical therapy right away, because one of the small risk factors is developing a stiff knee. And if you develop a stiff knee and can't get it straight, or even if you can't bend it, either or is not a great scenario. And you start developing stiffness, then you can run into problems, and we don't want that. So we tend to be a little bit aggressive, maybe not day one, but we want to get the knee straight and keep it straight so that you don't develop a little bit of a bend in your knee. Surgeons will not be happy with us as therapists, and certainly the patient will not be happy if we're not getting the knee straight. Getting the knee straight is important in order to walk normally. So it's very hard to walk normally with the knee bent. Phase 2, this is where you're kind of seeing the light at the end of the tunnel. The first 2 weeks are over, you're sleeping better. There's generally a lot less pain at this point. And this is where patients really start to say, you know, I'm glad I had the surgery. During that first 2 weeks, I don't hear that too often. Some patients even second guess themselves. But when they get to about 2 weeks, I would say the majority of patients are seeing dramatic improvements. So with the strength, with the range of motion or mobility of the knee, that tends to improve quite a bit from weeks 2 to week 6. And at this point, somewhere in this point, the patient's no longer using a cane or a walker. And again, you know, that could be closer to 2.5 weeks. In some really unusual cases, patients might need it up to 5 or 6 weeks. This is a patient that is about 4 weeks after surgery, I believe. He's in the Market Commons location. This is a guy that did very well, had knee replacement, and was able to go back to golfing at 6 weeks. We just discharged him about a week ago. He's doing excellent. We call him a rock star patient. He did very well. And so you can see that we're doing some balance exercises, and this would be typically like in that 2 to 6 week period, probably closer to 3 to 4 weeks. And but recreational activities are very possible at 6 weeks, including things like golf. Other patients need a little longer period, and we're not trying to break records and rush patients back too quickly. So we make sure that you have good range of motion, good strength, good balance, minimal pain, just good mechanics in general before you would go back and do something like, for example, golf. Once you get to phase 3, now this is where physical therapy is really coming to an end. We see typically patients about 6 to 8 weeks. So what happens after that? So after you're discharged from physical therapy, there's still a lot you can do at home to continue strengthening. and we will give you a home exercise program, maybe walking downstairs, step over step, higher level balance exercises. And definitely after 6 weeks is where you can begin resuming moderate household chores, maybe gardening, things like that in that 6-week period between 6 and 10 weeks. Again, golf is I only bring up golf because it's so popular in Myrtle Beach, but there are other activities you can do. We'll talk about which activities are safer than others and in a little bit. Now, keep in mind, all these milestones that we're using here for a hip replacement, it's much faster. So you could take everything we just talked about and kind of accelerate it, I would say a week to a week and a half, a little bit more for a hip replacement. So then phase 4 is well after your discharge from therapy. And this is, again, continuing to strengthen your leg muscles. And patients are really surprised that they still have swelling 10 weeks after the surgery, and sometimes quite a bit longer. So it takes the body a long time to reabsorb all the swelling and for the knee to really resume its, we'll call it its perfect appearance or shape. I've even had patients that had a knee surgery a year ago and they come back in and it still looks like a little puffy. That's not unusual. And I usually try to help patients that the first day they come in. So you can continue to improve your strength even a year, even up to 2 years after the surgery. And then I want to just talk about some common questions that we often get with regard to hip and knee replacement surgery. One of the common questions that we get is how long until you can resume driving. And so this is largely up to the surgeon. The surgeon often will make that call. Based on my experience, the average time is about 6 weeks to return to driving. Now, this of course depends if it's a right versus a left knee. Theoretically, you can get back, resume driving earlier than a right knee. And some of this has to do with your strength, your range of motion, but also regaining that reaction time. So the reaction time can be affected by the swelling and the trauma in the knee. So a lot of it's more about reaction than really strength or range of motion. For a hip replacement, probably a little bit earlier, because as we said, everything is a little bit faster with the hip replacement. But again, that's something that you would want to talk to your surgeon about. We'll talk about some activities such as tennis, golf, running, a little bit here. Now, just to bring up golf, we talked about the average time to return to golf is about 6 to 12 weeks after a knee replacement. For a hip replacement, a little bit faster. I can't say I've had too many patients go back much earlier than 6 weeks, but there's a greater chance you can return at around that 6 to 8 week mark with a hip replacement versus a knee replacement. So that is one question we get. Should I avoid impact activities such as running, maybe such as tennis? And this is always a kind of a tough question to answer because not everything is black and white. I would say that in general, I would not recommend high impact activities. The surgeon most likely is not going to recommend or advise against this. And this is because you have a natural life of the implant between 10 and 20 years. So the implant can last in that 10 to 20 year range. And theoretically, if you go into high impact activities, and if you do that for a prolonged period, you probably are going to accelerate the wearing out of the hardware. So in general, we don't recommend high impact activities. This can be hard for somebody that really loves running, wants to go back to jogging, for example. But we stress, we try to encourage patients to go perhaps take up bicycling, for example, which is a non-impact exercise versus, like, say, running. Walking is better. Walking is more, is actually very functional, but as far as walking as an exercise, there is some impact. But again, the rewards of walking probably outweigh the risk, which is a little bit of impact on the hip or the knee. So I am going to, there is a question coming in, and let me just, here's our first question, actually. So let me just read that off. What should I expect during recovery of a hip replacement while I'm waiting to have my other hip done in 9 weeks? So this is a person that has had the initial hip replacement, and then they're waiting. They're going to have another hip replacement in 9 weeks. I'm assuming they're going through physical therapy. Will I be able to learn how to walk again and be mobile without a walker or a cane? It's been years since walking without assistance. So this is called staging the procedure. So if you have one hip done or one knee done, like say you have arthritis in both hips or both knees, both of them have to be replaced. A lot of surgeons prefer to stage this out where you have the surgery done on in this case, the one hip, and then start the rehab. And again, the rehab for hip replacement is pretty fast compared to a knee replacement. So for example, a patient at 6 to 8 weeks out, probably 8 weeks, is going to be finishing up with that hip replacement. And then they'll be ready theoretically for their other hip to be done. Some doctors might wait a little bit longer than doing it right away, but they usually will get the rehab first, get strong. You want that right hip or the first surgical hip to be taken care of first, get that better, and then go to the second one. So this is called staging. Same thing can be done with the knee. I would say with a knee replacement, probably the time frame between surgeries might be a little bit longer because the recovery is a little bit longer. But the question is, will I be able to learn how to walk again? And I would say yes. Many times patients that come in having severe arthritis, they've been using a cane for a long time, and they get the joint fixed, replaced, they no longer have that pain. That's really a big reason why people use a cane or a walker. It's really because of the pain. So if you replace the joint, you can eliminate or nearly eliminate the pain, and then your walking gets better. So in this case, the patient probably would fix up the right hip. They're still going to use a cane because their left hip is still bothering them. They would get the left hip done. Another 9 weeks goes by, 6 to 8 weeks, I should say. And then hopefully the goal would be to get off the cane. And that's assuming there are no other issues going on that would affect the balance, neurological issues or things like that. But this happens quite often. With the knee replacement, I would say that some surgeons, I've had patients that have had both done at the same time. Very difficult to do that. You have to be in very good condition. And by that, I mean, strong upper body, because now you're dealing with 2 injuries at the same time. That is done in some cases where they don't stage the procedures. Pretty challenging. The benefit though is that you get it all done at once, but again, that requires a special kind of patient, upper body strength, support around the house, because typically you'll be in a wheelchair for a little bit for a double simultaneous procedure. I'm kind of getting off track, but I do want to bring up that some patients with knee replacement surgery have pain longer than others. And we're going to talk about that towards the end. So keep that in mind with the entire presentation. Here is another question. Patient had a hip replacement. What can I expect after I finish PT and follow up with your physical therapy guidance after bilateral hip replacement? Should I plan on months of PT or split time between home physical therapy and clinic PT? And I would say in general, 6 to 8 weeks of therapy, and that's it. And then after that, we give you a home exercise program, a post-rehab program to follow, and you're on your way. And then, many patients at that point may join a gym. Although at this time with COVID and everything, that's been disrupted a little bit, but basically get back to higher level exercises that you can do on your own. And we go over all that on your last day of physical therapy. And of course, some patients even call down the road with questions. And of course, we can answer those questions as well. But no, you should not plan on months of PT. Back in the old days, going back many years ago, where the surgeries were not as advanced, then yes, longer physical therapy time. But with all the modern advances and in surgeries these days, that's not necessary. I've already answered this question, but is the, let me just move something on the screen here. Is the recovery faster after a total hip? Absolutely, versus a total knee. There is a big difference. The recovery is generally much quicker after a total hip versus a total knee. And with the knee, for whatever reason, and an orthopedic surgeon can probably have a better answer for this than the knee. But the knee generally has more inflammation to the joint. Some call this like a hot knee, if you want to think of it like that. That knee can stay pretty warm, pretty inflamed for quite a while. And some patients have this knee that just stays warm longer. It's probably more inflamed. And so that can happen. And in other patients, they don't have that prolonged inflammation. But in generally, a total hip is much faster as far as rehab goes, as far as the rehab process. Okay, so I'm gonna move on to the next one. And I think there was actually another question. One of the questions is, can I go back to twisting activities? For example, yoga, or things like that. There are certain precautions, more so after a hip replacement, in terms of not being, for a period of time, you don't want to bring your leg behind your body with some extreme stretches, for example. So there are a couple movements that can, cause a little bit too much stress on the hip replacement. So there are, those are kind of things that are gone over in physical therapy. But that's another one. Tennis is another sport. I would say doubles tennis, where you're having much less impact. Pickleball seems to be a big, really popular sport down here. These are activities that can be, resumed at some point with, again, with the proper rehab, and as long as it, as long as you have good range of motion, good strength, good balance. And that is pretty much the kind of the general recovery after surgery. So in summary, hip replacement and knee replacement are both very successful surgeries, and a little bit rough in the very early going, particularly for a knee replacement, not as much for a hip. You get beyond the first 2 weeks, and most patients are really happy with a hip, probably earlier than that. And there's more information. You can go to the OrthoSC website, orthosc.com, go to patient resources, and there's a lot of more detailed information on prehabilitation, rehabilitation, and other facts about the surgery itself that is really a nice reference for anybody thinking about starting the initial research for surgery. So I want to thank you, and I'll ask any answer any questions that you might have. There are a couple that I'll look at here. Okay, so here are just a couple more questions. I have a 2-story house. Can I assume that it'll be 6 weeks before I can navigate the steps? For a hip, that's very, very reasonable. And even for a knee replacement, 6 weeks is reasonable. More so for a hip, I would say definite for the hip and very likely for the knee. And when we say walking normally step over step, that would be normal at 6 weeks. Going down can be a little tougher. After a knee replacement, going downstairs is a little bit more challenging than going up. Maybe a little bit longer to do step over step going down. Maybe a little bit longer than that, but step to step, yes, going downstairs, not an issue. Step over step, maybe a little bit longer for a knee replacement, not so much for a hip replacement. I am having hip surgery and coming home the same day. My house has lots of stairs. Will I be able to use them right away? When you say use them, I would say for a hip, the same day, that's a little rough. Hip surgery is easier than knee surgery, but I don't know about that much easier. The first day is still surgery. So typically we would advise patients to set up a bed. If their bed is upstairs, downstairs, or pull-out couch, recliner chair, at least for the first couple of days, 2 to 3 days. And I think stairs for a hip replacement, doing step over step is reasonable within a few days. But the same day, I would say that would be a tough challenge to do that for most patients. You said there could be some long-term pain with the knee replacement. How long? That is a great question, and it ranges all over. So, you know, right now we have patients that have it for a few weeks, a couple days in some cases. That's really unusual. But I've had other patients that can have pain for, unfortunately, several months, and even in some cases beyond 6 months. Now that's not normal. So if you think of this as like kind of like a bell-shaped curve, you know, most people are going to be like in that middle 6 to 8 week range, and then a little bit longer. You have people that have up to 6 months or longer in some cases. And I don't know if anybody can explain a lot of this. It's certainly, some people just are, as I said in the beginning of the presentation, they, for a lack of a better way of explaining it, they're wired differently. Our nervous system, there is something called central sensitization, which is that the connection between the injury or the joint, in this case the knee, for example, and the brain, you have a lot of nerve activity, messages being sent back and forth. And there's quite a bit of evidence to show now that you can have changes take place in the brain due to a reorganization of pain receptors that actually affect the brain. So there actually can be some changes for a period of time in the brain. And as one physical therapist that I worked with said, the nervous system is just jacked up in some people. It's just on red alert longer than another person. And this is probably genetic, maybe personality driven. Anecdotally, I've seen, in the past, patients that were involved, like in the military, for example, they don't seem to have as much pain. Whether they tune it out, I don't know. But pain is it's very variable, and there's probably a lot we don't understand about the pain. But I would say that's unusual to have pain that long. But I'm not going to, I'm going to, in full transparency, some patients do have it for that period of time. And it's important to know, though, that even in that case, it almost always resolves at some point, beyond 6 months. So hope that answered your question. And let me I think that is it on the questions. Let me just double check again. So if there are no more questions, then I really want to say thank you for tuning in. And there is actually another question. Yep. Is there a special diet recommended? And it's a little bit out of my territory. I'm not a nutritionist, but I can tell you that it's always a good idea, as long as you don't have any underlying conditions, and that always needs to be considered. But it's probably a good idea to get a little extra protein. Your body needs to rebuild those muscles, and anytime there's an injury, I think some extra protein is always a good idea. Again, if you have kidney issues or other issues, you always should consult with your doctor. But vitamin B is important. Your essential vitamins, anti-inflammatory foods such as tart cherry juice. I know that sounds a little bit strange, but tart cherry juice is a natural anti-inflammatory. It's last I checked, it was endorsed by the Arthritis Foundation. Blueberries, these are anti-inflammatory diets. I would say a diet that would be what they would call an anti-inflammatory diet. And you could do some research on that. But things like blueberries and tart cherry juice, or even tart cherries themselves can do that. Other than that, I would just say vitamin D is important. I may be missing one or two, but those are some of the more important things. A little extra protein and plenty of water. After surgery, especially that first week, you tend to be dehydrated, and with the medications, and water is so important. Proper hydration affects everything, including muscle function. So that's extremely important. Is it easy to get in to see you? Are your doctors at OrthoSC? Is the Market Commons office 5 days? Is it open? Yes, you can call up the office and you can schedule an appointment. We typically recommend scheduling an appointment with the orthopedic specialist, one of the orthopedic surgeons, and just to make sure before you just start in on therapy that everything's fine. Perhaps an x-ray will be taken, but they can do a basic medical or a clinical exam. And then I think that's the best way, because then we can work hand in hand with the surgeon and we have more information that way. So get cleared by the surgeon and then come in for physical therapy. First step would be to call the Market Commons office. As far as the physical therapy side, we are open 5 days a week, Monday through Friday, currently accepting patients. And so that is not a problem to call and schedule that. And another question, will this talk be available on the website? That is a great question. I'm not sure. Oh, here we go. Yes, in a week it will be up. So you can go to that same website, www.orthosc.org, or you can go to the orthosc.org and then scroll to where it says patient resources and then video library. So orthosc.org, patient resources, and then video library. And that's where a lot of the other resources I talked about before are also there. So you get a better idea, a little bit more specific idea of what therapy is all about, maybe specific exercises or more details about the surgery itself. So I'll just wait another minute or two. I don't believe there's any other questions. And that should wrap it up. So I want to thank you for tuning in and wish you the best of luck with your condition, your hip or your knee condition, in whatever decision you make. There is two more. Okay, I'm sorry. I jumped the gun. There are two more questions. Apologize, I didn't see that before. What is the appropriate age to have a knee replacement? There isn't really an exact age. I would say most patients are getting knee replacements in their 50s and 60s. Now, the problem is if you get it done early in life, let's say I've had patients that have gotten it done in their 40s. I can't think of anybody that had it earlier than their 40s. But the problem is there that if the life of the implant is 20 years, for example, and you're at 40 years old, then at 60, you'll need another one. Now, I know what you're saying, some patients view that a little bit differently, and everybody can have their own view on that. Surgeries are changing all the time. Who knows what's going to be around in 20 years from now with stem cell technology and all sorts of orthobiologics, which is the next wave of, surgery and everything. But that's just something to keep in mind, that if you have it done early, you're probably going to have another surgery because you're going to outlive your implant. So that is as far as the early age. Now, as far as the other end of the spectrum, later in life, there's not an exact cutoff. I think the oldest patient I've ever had, probably in their late 80s, and they were in good condition. And the reason why you don't want to operate in general on somebody much older is because many of the times they have other comorbidities. Maybe they have, some cardiac issues, things like that, where anesthesia is a concern. Can your body handle the stress of the surgery? And this is something that the surgeon, that's why they went to school for that period of time. They can make those decisions based on a lot of factors. So looking at comorbidities, things like that are important. It's not an exact age, and it depends on your condition. And that's just a kind of an overview on the age question. So again, thank you very much for tuning in, and I hope that this was informative, and see you on the next webinar. Okay, I apologize. There actually is one more question that I didn't see. Will there be more talks coming up? Yes, there are. There is a shoulder surgery and a shoulder rehabilitation, as well as Dr. Evans is doing a talk on more on the surgical side of shoulder. And that's April 15th for the next webinar. And that will be on shoulder disorders. So April 15th will be the next webinar. And let me see if there's any other questions. I think that is it. Double check here. And we are going to talk about the golf swing shoulder rehabilitation, and we're going to talk about in relationship to the golf swing, or the golfer that wants to return to golf with a shoulder injury, whether it be surgical or non-surgical. We'll talk about that. So April 15th is for the next one, and that's with Dr. Evans, and that'll be more on the surgical side of shoulder injuries. And then April 20th will be more on the rehab side, but kind of specifically geared towards the golfer with a shoulder problem. And I believe that is the last question.
Bob, did you answer the question on the ice packs?
I did not. I must have. Let me scroll back on that, see if I had skip that somehow. Let me, 1 second while I.
Bob, the question is, for hip surgery, can I use ice packs instead of purchasing an ice machine?
Okay, the question is if you can use an ice pack after hip replacement versus an ice machine. So a lot of times ice machines are used. I think it's more important after a knee replacement surgery. And just to quickly back up, an ice machine, for those that aren't familiar with it, it's basically like a cuff that you wrap around and has compression, a little bit of compression to it. And a hose is circulating water into that ice pack from what looks like a cooler, basically, like a cooler you go on a picnic with. So basically, that ice machine is recommended after a lot of surgeries. I'd say overall, that's more important for a knee surgery because of the greater inflammation and swelling versus a hip surgery. And so I'd say absolutely ice pack is fine after hip surgery. We'd recommend the ice machine in most cases after a knee replacement. But I have patients that, for whatever reason, don't use the ice machine. And then we just say, okay, make sure you compress that ice using ACE wraps or something to get some compression. So is it absolutely essential? Not really. But for a knee replacement, I would say it definitely is recommended. I'm not going to say there are not any more questions. So let me, no more questions. Okay, so there are no more questions. Great. So again, thank you for tuning in, and we'll see you on the next webinar.
Bob,
Yep.
actually, another question just came in. I'm really sorry.
Okay, sure. We have a late question. Sorry, I didn't mean to skip that one. Let me just cancel this. Okay, there actually is one last question that came in. Can I return to dancing, Zumba, and Tai Chi after a knee replacement? I'm 85 years old. Wow, that's great for 85 to be doing that. That's terrific. Again, there's no age limit on these things. Now, what I would say is that if there's any high impact activities, I don't know every move about Zumba, apologize, or even Tai Chi, but I'm assuming it's no impact. Maybe somebody else has a different answer on that. But if there's not high impact involved, then certainly going back to those things after knee replacement. There might be some modifications. For example, if a patient were to come in and with Tai Chi, if there's a couple of really, extreme stretches where you're really torquing the knee, then of course we might have to modify, but many times patients can go back to these kind of activities with some modification. Same with dancing. I'm assuming the dancing is relatively low impact. So yeah, I'd say not a problem in general, but probably with some modifications. Regardless of your age, really the age is not the main factor. It's, your strength level. And if you're doing those things now, then there's no reason why you can't return to those things, with some modifications, I would say. Okay, so I think that is it for that. I'll just hang on for another minute or two until I make sure there are no other questions. Okay, I think that is it. This time it's for real. So thanks again, and we'll see you on the next webinar.